three.
Hello, everyone, and welcome back to For St. Pete's Sake. My name is Christian Hotchkiss. I'm your host, joined by the amazing Laura Gherkin. Laura, how are you today?
I'm good. How are you doing today, Christian?
Oh, phenomenal. I'm so happy to hear it. It's another Wednesday. We got another episode, and we have a very impressive guest. So I'm really excited for this.
Absolutely. We do have an amazingly impressive guest on today. We've got Nathan Bruemmer. He is a well-known activist down around here in St. Pete, and I will actually just let him hop in and give himself and introduce himself.
I was
Oh,
going to say, I don't think we can give your resume the justice it deserves,
Right.
Nathan.
well, I'm just a guy in the community that likes to lend a hand and make a difference from time to time. Let's see, what would the listeners, I mean, I'm not originally from St. Pete, but I am from the Tampa Bay area. But I've been in St. Pete now more years than I was over on the other side, born and raised in Tampa. So I'm proud to be a USF graduate and a Stetson Law graduate. I was an advocate from like the time I was knee high to a grasshopper, as the old family would say. So been rebellious and asking questions, sometimes too many questions, and that's what gets me in trouble because I just can't help it. But those are the stories my mom used to tell me. But no, I mean I'm an attorney by day and continue to be an advocate. Do a lot of policy advising and consulting, but used to be a school teacher in Hillsborough County. I love working with students, continuing to support students through some nonprofit, volunteer work. Had a number of years in leadership with St. Pete Pride. Really enjoyed that. That's a very special part of St. Pete, without a doubt, and still a part of my life. I just love supporting community-based events, and I'm always looking for new projects to do that work. But right now, I'm really spending a lot of my time with a lot of pro bono or low bono work, as we say it. There are a lot of questions and a lot of things changing very quickly, and so that's, I think, brings me to the conversation today. But
Yeah,
um, that's a little about me. I'm a
awesome.
Libra, likes long walks on the. No, I'm just,
Hey, I'm a Libra too. Love that.
Love-
Uh, just
that's
to
the
give
justice and fairness in us.
Exactly.
Yes, there it
Exactly.
is.
That's why we fight.
Right.
Just to give our listeners a little bit of your professional background, I should say.
Sure.
You've been in the Democratic Party for a long time, and I'm pretty sure you've held every title or seat there can be except for chair.
Yes, I have done that as well. But I've worked for our chair. I was fortunate. I think one of the highlights on my professional resume was serving the state of Florida and serving the people of Florida as our state's LGBTQ consumer advocate, and that was just a really leading initiative when Chair Freed was Commissioner Freed for the Florida Department of Agriculture and Consumer Services, and it's the state's second largest agency outside of the governor's office. Responsible not just for agriculture, which is an important industry in our country, but also as our consumer protection agency. That's the consumer services side. So I got to do a lot of outreach across the state around consumer fraud and discrimination protection and prevention. And that was a real joy for 2 years for sure. But yes, I've served in a local party as vice chair, and as you also have, Christian and Laura, also you're doing great work with our caucus, and was honored to serve as our statewide LGBTQ caucus chair for a time. And then I threw my hat in the ring and chose to run for office last cycle for state house, and believe representation, without us doesn't work. So we've got to lean in and be a part of, finding the solutions and not just talking about it. Didn't work out the way I had hoped, but I really enjoyed the whole process. I know not everybody says that, but I think for me, the best thing was knocking doors and getting to know constituents and getting to hear what their real concerns were. Um, which will continue to inform my work until who knows what comes next. But yes, I appreciate the shout out on that, Christian, for sure.
No problem.
Absolutely. And
I
when you ran, it was you just to give context to the voters, you
Yeah,
were running in like the St. Pete district, which goes from like it starts in like downtown St. Pete, right, and goes out to the beaches. And
it's like, yeah,
so,
it's West St. Pete. It is the
okay.
largest district by precinct numbers. It has over 60 precincts, which is larger than any other district. and it's remarkably diverse. It also has 13 of our 24 municipalities within it. Most of the district is, though, on the water. And so, as folks might know, we, of course, suffered two really tragic hurricanes. My house in Gulfport was spared, but was the end of the debris field and saw some damage, minimal compared to my neighbors for sure. But that really impacted District 61 more than anything.
Yeah,
Uh, but it's very diverse. I mean, there's a lot of different cities. The beach community is what it is. The city of St. Pete is different. Gulfport is different. Kenneth City. Um, but in some ways, I discovered the personality of a lot of different communities and Pinellas than I'd seen even growing up here and being here my whole life. It's fun to find those spots, good places for coffee, good spots for food that, I don't, normally I'm not aware of. So, um, Pinellas has got a lot to offer
yeah.
Oh yeah, there's a
in
lot of
hidden
hidden gems
spots.
here in Pinellas.
I
That's
know, I
that's
know.
what I love. And they say that you can go and pick just in Pinellas County alone. You can eat at a different place every night
Oh,
for 5 years or so and still not have to repeat a restaurant.
Wow.
oh, for sure. And some of those restaurants have so many combinations. I think I read an article in one of our favorite local magazines that like this one restaurant can do like a million combinations of food or something crazy.
Oh my
Like,
God.
yeah, yeah, it's like
St. Pete's the best.
we got
It
options.
is.
Hey, for St. Pete's sake.
Exactly.
Exactly, exactly.
Wow, you
Uh,
guys did that in unison. Well done.
well, we want to get into the hard hitting stuff. This is a
Okay,
podcast where we deep dive into Democratic politics here in Pinellas County and
that's right.
beyond the state of Florida. So let's just dig right in. You are a veteran. You served for our military, which thank you very much for your service.
Sure.
Mhm.
Um, how, why?
Well, so there's a bit of a story there.
Not why did you serve, but
Yeah.
what's going on right now is what I mean. What
Yeah,
are
yeah.
you seeing? What are you hearing?
Sure.
Kind of thing.
Yeah, so it's been an interesting couple of months. So I served for a very short time. My father is really what motivated me to serve. So I can't not talk about this and not honor and uplift my father. He's been gone quite a few years, but he was drafted in World War II to serve in the Army. His brother served
Mhm.
in the Navy. He was in
Mhm.
the European theater. My uncle Norbert was in the Pacific theater. But Dad was on the ground in infantry, and they both came home. He was a prisoner of war in the Black Forest, a part of the Battle of the Bulge, received a lot of honors, but he came back a pacifist.
Mhm.
And he actually studied to be a Catholic priest for a time. That obviously didn't stick because he met my mom and they got married and had a wonderful long life together and I came to be, but he really is the person who instilled public service in me, starting from the time that he was drafted and understanding what he was fighting for, given that historic context. So um, I thought about even in high school joining. I was originally interested in pursuing going to one of the military academies, and he was adamantly opposed to it. And as I got a little older and it was college time, I was trying to do it independently without depending on my parents. And the best way I could figure out how to do that was to serve part-time in the Florida National Guard. And so I signed up. He was not happy.
Mhm.
He really was worried about what that might mean, knowing what maybe I didn't know. We had not at that time we had been at in peacetime and not in wartime for a good part of my childhood. We can't say that for younger generations, of course,
Mhm.
anymore, but he really instilled the truth of the matter and what it meant. And I said, "Well, Dad, you taught me this." And he basically wanted me to, consider not doing it, but I didn't. But as circumstances would have it, I signed up for the Florida National Guard and I tested quite well in the ASFAB and I was excited about doing what I was doing and I delayed going to basic training for a time and went to my monthly rotation. And at basic training, some things were not going quite as they should have been. And this was at the time that don't ask, don't tell was still the policy of the land. And
Mhm.
somebody asked, and I probably one of the reasons I'm an attorney, but I'm a rule follower, bit of a stickler with a pretty deep moral compass. And I tried to dodge the question and they asked again, and I had to give an honest answer, and that, at the time that was a problem. So it meant an immediate discharge. So I didn't finish my training. I didn't get my, college bonus. And I came home and, you know, of course, dad was happy, and I think my mother as well, and probably my partner at the time, but it will forever stick with me because there have been many times over, several different career decisions I have made. I have tried to serve um, my country, my community, and have been told, no, thank you, you're not welcome. So that is a challenge, and I sort of put it away and let it be, and didn't think about it a whole lot until I got to law school because I didn't really think of myself as a veteran. And when I applied, I didn't check the boxes right. And I talked to the dean afterwards because everything gets submitted to the Florida bar on your application. And he said, well, you technically, when you're training at basic training or AIT, you were in active service during that time. And you do have to list it. My dad served. I
Mhm.
have friends who served in Afghanistan and Iraq, multiple tours. I have a lot of friends who are veterans, members of the LGBTQ community, and in honoring their service and what that has meant, didn't feel that I'm just not in the same class. I mean, I'm just not. I wanted to be, but I didn't. And this dean, he said, nope, you gotta get your head around that, and also amend your application, and then make sure you disclaim all that the right way to the Florida bar. So I did. Um, And after that, 2016, I happened to be in DC, and a lot of friends who are now, active at that time, or who were had been discharged after serving and having full careers. And so at that time, a Secretary of the Army was an out gay gentleman,
Mhm.
and we had pride at the Pentagon. I had been lucky enough to get a fellowship during law school my last year, my last semester with, at that time, what was called the National Center for Transgender Equality. And I got to participate in all the federal agency programs that summer. Um, that was the best. I went, to the Pentagon and, watched the Secretary of the Army and met all these LGBTQ troops, and then got to sit down. It was not exciting or sexy, but we had lunch in the cafeteria, and it was a table of about 20 um, both trans service members, active duty service members, or veterans in every branch
Wow.
and every rank, enlisted and officers. And as the updates have come through since January 20th, those are the folks I've thought about a lot. Uh,
Mhm.
I've watched their careers blossom, their leadership blossom, their promotions through their careers, and they've been, able to serve our country in phenomenal ways. And that shifted, as we know, in the first administration under Trump. He had an idea about trying to ban trans service members then, and he came back in with that as the intention as well. So here we sit. But it's not going his way because there are some court cases that are telling us, like, I don't think that's going to work. So, really, I mean, it's interesting to think about the difference between service members who are getting care through TRICARE when they're active
Mhm.
versus as a veteran at the Veterans Administration. And so those are two very different delivery systems for healthcare, right? Um, but in the case that is still moving through the courts, the administration is basically barred from removing trans service members or restricting their medical care, and that's good news. But I can tell you anecdotally, I know as the processes move forward that folks have decided to retire early or separate,
Mhm.
which is unfortunate.
Yeah.
Um, and I think that was part of the point, to impact recruiting or scare off, trans folks from serving, no matter how many years. And some have served, 4 years, 10 years, 20 years, career, 30 years.
We've seen this administration, it's
Yeah,
basically take a sledgehammer to the entire federal government at this point, and
yeah,
what they're doing to the VA and veterans across the board,
yeah,
letting go of what was it, 80,000 VA workers,
yes,
um, barring people from serving, you
yep,
know, all of that sort of stuff. wild to me. I don't know why you would ever want to stop someone from protecting us, from protecting our country.
Right.
I I don't know either. The VA has been really proactive in supporting veterans. From the healthcare side, they have I can't remember if they call them LGBTQ liaisons or care. Um, they're like care coordinators. Like every VA hospital has been intentional, and on the website to this day, they're still taking a look and focusing their patient care without question to recognize that you have given the country service, and we're going to give you respectful, dignified care no matter what. And I think people think about healthcare for LGBTQ veterans, or maybe more specifically for trans veterans, like it's just gender affirming care, but it's not. It's all the service needs. And so your entire, medical record might be there. If you served in a foreign war, you might have very complicated medical needs. And aside from the fact we're just getting older and we need help. So the idea that they're so welcoming to veterans, our families, our caregivers, um, not allowing bias or discrimination or health disparities and advocating for that is great. But Christian, to your point about the layoffs for every veteran, unfortunately, I spent time in law school working for the Veterans Clinic. We have a really fabulous Veterans Law Institute at Stetson University College of Law. And we actually have gotten, I just saw this post this week. Their director is somebody I really respect quite a bit, former Army JAG officer, Stacey Ray Simcox. And I saw her post that they were recertified as, one of the best military institutions as a law school, because being a military friendly, welcoming institution is a big deal. But we also have this Veterans Law Institute that's doing pro bono work. Veterans benefits have been really complicated and severely delayed for everyone. And over the last several years, you are seeing the time from when you file a claim to when you receive your benefits getting shorter and shorter and shorter. Um, that will not be helped by those layoffs. And I understand immediately, talking to lots of folks in community, that getting appointments, and especially with certain specialty needs,
Yeah.
is really it's a challenge. So I'm not sure what the impetus of all that is, especially since the motivation seems to have been about, all the negative, ways they want to talk about LGBTQ folks, to have a strong fighting force. If we're not healthy, if our families aren't healthy, I'm not really sure how we're focusing on our military service members or on our service member families, but we shall see. The case continues, and I'm hopeful. I always remain hopeful, but it's got a pathway of uncertainty for now, unfortunately.
Is that, and will you remind me, is that one that was filed in the Texas court, so it does have a rough like actual litigation path, or I
There were um, there were two cases. One is moving forward on appeal. The other one is not. I'd have to pull up the case because I read it. I don't have it handy in front of me.
no, that's okay.
But I do know at this point, like, it's there. I mean, there are a lot of, unfortunately, it used to be in tracking cases, there are only a handful of cases. There is a lot of litigation going on right now with
Hmm.
this administration's policy decisions. And frankly, there are a lot of case decisions pending in state courts that were already happening before we had executive orders sort of dropping, yeah,
Dropping every day.
every day.
Yeah, it does seem like we get a new one every single day, and
We
none of them mean anything. I mean, you look at his first 100 days in office, and he accomplished nothing.
No, and I appreciate you mentioning that because it's true. Like these are proposed actions, right? So
Right.
if we spend time talking about some of the other healthcare impacts through the other agencies that are mentioned outside of veterans, because realistically, like where we get our healthcare is from a variety of sources, and
Right.
it isn't. I mean, if you happen to be a veteran, you get it through the VA, and your family may get it through that. You may get it through other sources, but these are proposed actions. The executive branch wants to say, here's an executive order. This is what I'd like my agencies to do, and I direct them to do something. So we're 100 days in now. What's interesting is a lot of those executive orders required the agencies to do something and report back. And a lot of that reporting back was, at least 60 or 90 days out. So depending on when it dropped, now we're supposed to be getting status updates on what these executive orders were. Some of those include, healthcare updates. There was one specific to gender affirming care for minors, and that report just came back April 28th. So like we're sort of in the midst of getting, and it's basically a pat on the back. Look, we're doing what we say we were going to do, but they're not fully implemented. But they are having an effect. What we have heard in the media is referred to as a chilling effect. People are just choosing, nope, I don't want to be on the radar. I don't want to get attacked. So I'm just going to stop whatever is the thing that this administration is talking about. And so there's a lot of that happening. But we really are finding a lot of the agency's actions are being enjoined by the federal courts. They're like, nope, got to stop, don't get to do that. Um, or still in litigation and it's to be T. But this administration has said, and we have the attorney general that also comes out of the state of Florida,
Oof.
also a fellow alum from Stetson.
Oh.
And she has said, like, we're going to follow this through on every single case. So, they're going to appeal. It's got to go through all the layers. So we might not know until things actually make it up to the Supreme Court what it's going to be. But in the meantime, we've got real world impacts about these decisions. I and we have more things that are coming to Christian's point. Like this is what we know, and we'll see what else comes.
Well, and it's just, and the thing with the EOs is like, yeah, they don't, most of them don't do anything
Nope.
per se, but it is messaging. So, like, it is
Yes.
messaging to people in the States. So, like, there was, I don't remember if it was came from Trump or if it came from RFK about fluoride. We're taking fluoride out of the water. Well, what
Right.
did Florida do? Florida
Right.
passed the fluoride ban.
That's right.
So,
Yeah. Well, because government is meant to be the trusted source, right? And so, we're in, when we elect folks to be our representatives, intrinsically, like we want to believe, we want to trust. Um, but we also have to stay as an informed electorate. I mean, we have to be aware and we have to call BS when we hear BS, right? I'm not sure how your podcast is rated, but I'm going to keep it there. But I mean, like we have to stay informed. And so the everyday human right now is probably not tracking all of the administrative actions that this administration is taking. They're not tracking all the executive orders. They're not tracking all the litigation. I do that with, a number of the roles that I hold. Um, and even doing it more hours than the average bear, it's not my full-time job to just track it. It is enormous and it's challenging. I'm grateful there are some interesting litigation trackers out there, but even some that started early on, or even some executive order trackers, they're not updated as often because there's still a lot coming out. The pace at which these things are coming out hasn't slowed down. And it was a little bit complicated as we were working through like our Florida legislative session, because I think you're right, Laura. The cues have been coming from the administration, but what I appreciate, and frankly, this has been on both sides of the aisle, shocking but true, that people are not as responsive to some of the cues they've been getting. They're like, hold on, that's a wee bit far. And when that tends to happen is when it impacts our own families and our own lives. So when we talk about things and folks don't have a connection to it, it's really hard for folks to get behind it and understand what it is. And so, like, it you have to find a way to stay informed, but I also would say you have to find a way to not drown in the information at the same time, right? So know who your trusted sources are. Question. I mean, when I used to teach um, in Hillsborough County, I was teaching mostly technology and trying to teach students to be smart about, like, have a critical eye with what you're looking at online.
Mhm.
Question your sources. Check it. Is it accurate? Go back and check it again. Is it a headline? Is it verified?
Right.
And we're in this great misinformation world these days, that the mischaracterizations that are happening on a lot of these issues, especially around healthcare, is ridiculous. But here we stay.
Yeah.
I'm always telling people not to get lost in the headlines because that's there he exactly flood the zone is what it's called, and that's exactly what he's doing. He's making these outrageous statements and EOs and all that sort of stuff because he's actually doing damage on the behind closed doors,
Yes.
like gutting the VA and the Department of Education and all of it. So
Oh yeah, the chaos is intentional, and there's a lot of it right now. And I'm not going to lose sleep on it, but I wonder, well, what the strategy has been, look over here, and it's
Yeah.
like a magician, right? Look over here, and then I'm over here, and I'm pulling something else away. And that's the part I worry about. I have trust that the collective, environment of folks that are tuning in on this will make sure that doesn't happen. Because you
Hmm.
have folks that are very focused in serving certain communities, right? And I love that. And they're coming together, coalition building, recognizing like we only have so many resources. And there are a lot of attorneys giving away a lot of pro bono time, and still people need more help. And there's plenty more litigation probably getting teed up that hasn't even started yet. But yeah, don't drown in it. Don't drown in it. But it's a moving target, no doubt.
So what are we've covered obviously, excuse me, the staffing changes at the VA, the
Yeah.
slashing is impacting the delivery of services and benefits.
Yeah.
And what about how about for general like healthcare in general?
Yeah.
What's been going on that front in our first 100 days?
Yeah. When I think about healthcare for LGBTQ folks, like, I mean, healthcare disparities has historically been a problem. Like where we were before these 100 days started, we were on a path of, recognizing good health equity and what's possible. The United States, the federal government is one of the largest sources globally for research funding. And so we've had a lot of programs and commitments that have been made, and great progress. And we've been supporting global initiatives to end HIV by 2030, for example.
Hmm.
And we've committed, invested $1 billion a year in HIV prevention. For some members of our community intersectionally, like they have not had the same health equity across the L, the G, the B, the T, the Q,
Yeah.
the plus, like, and so if you're, a Black trans woman, and if you look at the results in, let's say, the last U.S. trans survey, which came out in 2022, or the data was 2022, I think it actually was released in 2023. But year over year, when they've done their surveys, most trans folks just don't have access to healthcare, first of all.
Hmm.
If they do, it's probably not covered by insurance because they probably don't have stable employment. And if they do experience, have the ability to go to have healthcare, looking at some of the numbers from the most recent survey, um, nearly half reported basically having a negative experience in the last year. Basically, they were refused care, misgendered, mistreated with abusive language, or even like physically, abusive treatment. And um, it's great that a lot of folks have health care. But we also have a lot of trans folks in this country that depend on Medicaid for their health care.
Hmm.
So, when we gather like the bigger picture, we have economic disparities and health disparities within the LGBTQ community that we continue to work on. And that is both for physical health and mental health. And then we have this transition, and there was a lot of forward progress that, both President Biden and Vice President Harris were championing that were phenomenal progress.
Hmm.
But the attack on LGBTQ health became like was immediate. So I mean, like just running without going too deep into the details, I mean, funding has been cut, right? So grants in the middle of cycles have been just paused or cut. It's of course includes, all medical issues, but I don't want to not like really highlight HIV prevention and, cancer and youth suicide and other like really critical needs. Anywhere, any way in which we show up, we're being erased. Now, this is no different than what happened in 2023. One of the things that just hurt my heart because of my personal work in this technically, but we had developed a resource page in 2023 at FDAX under Commissioner Freed's leadership when the Florida Department of Education pulled all of our resources for bullying and supporting LGBTQ youth, I said to the commissioner, like, this is part of our mission too. Can we provide this information? She said yes. And I said, and can we do it better? And she said yes. And so we had resources for families available, and immediately after the administrations shifted, it was all
Mhm.
deleted. Everything from every DEI initiative. And I was the LGBTQ director, but she also had put in place a DEI director specifically looking at bringing, federal money down to support diversity within agriculture and consumer services and all the missions across the agency. But eliminating the resources, eliminating questions that ask. So the research itself isn't asking about LGBTQ people. We're not even collecting the data. So we're not going to be studied. Just stop. And then there's also been a decision to eliminate asking about our identities as a part of our medical record. So that started with it being deleted from government agencies, but now that's carried over into private because, the government folks decide HHS has this standard electronic health record that they put forward, and they're like, nope, you don't need to do that. So when you think about when you go and do an intake at a healthcare provider,
Mhm.
the beauty of database and technology these days is that record can go with you. So as you move through the continuum of care, everybody has accurate information. But if they're not aware of who you are and they're not even going to ask or think about it, that's a problem
Right.
from a whole lot of reasons. And not just the way you're treated, but diagnostically, that's also a problem. What our risk factors are,
Yeah.
um, what our habits might be health wise. So, and we've already talked about the elimination of positions in the VA, but positions are being eliminated everywhere.
Yep.
10,000 plus positions in HHS, deleting, like erasing entire um, divisions. I think some of the biggest things I'm worried about within HHS are programs that serve our elders and programs that serve our youth.
Mhm.
So right now we're facing the elimination of the LGBTQ youth program under the National Suicide Hotline, right? That's 988. Um, and they specifically have specially trained people for two groups, specialized experts for our highest risk groups. They're veterans and LGBTQ youth.
Yep.
That's unfortunate because if you look at the data for how many contacts there have been, and should that go away, I mean, there's been an increase already at Trevor Project's Lifeline and also at Trans Lifeline. If 988 no longer provides that service, I don't know. Trevor's and Trans Lifeline are going to need a whole lot of support.
Actually the Canadian suicide prevention hotline created a American number to
I
call
did,
in.
I did see that. Yeah, which will
So,
be, yeah, as long as people get that information, that's
right.
another thing. Yeah, I
What
mean, so yeah, and we're also like we've eliminated positions, we've fired experts, we've
Mhm.
eliminated certain offices, and then of course we're attacking, for trans folks, we're attacking all the access points for gender affirming care, period,
Right.
with some pretty horrible updates there. So I mean, um, and when you drill down specifically into HIV healthcare, if you would like to talk about that, that doesn't
Yeah.
just put the United States at risk. That's global public health at
Hmm.
risk. Which is, I mean, the analysis on that and some of the results are just coming back about how extensive this would be. And there's a big difference between health, like when we talk about my health and well-being individually versus public health and how these policy decisions will have, exponential impacts, good or bad, as we make these decisions today. I saw a report that came out through uh, UNAIDS, right? So we know USAID, the United Nations has an AIDS focus, but UNAIDS predicted basically that if we permanently discontinue what's been paused for 90 days through PEPFAR, we're going to see 6 million more new infections by 2029 and see 4 million deaths. So the idea was that we were going to eliminate this public health threat by 2030.
Hmm.
And President Trump in his first administration made that commitment.
Yeah.
He supported that. And he's reversed on that. I don't
Well,
know.
in PEPFAR, if I remember correctly, that was HW or W
Oh,
project.
initially? Yeah, I think initially, yeah.
Yeah.
And then
So, and yeah.
yeah,
So
yeah.
it's just, I mean, it's not like, Obama created it and then it's like this has been a long standing and it was, under one of the Bushes. So,
That's
yeah.
right.
It
I
just
mean, that's
seems like
like, sorry, Christian, go. Go ahead.
no, you're totally fine. It just seems like they literally pulled up every one of their websites or every one of the federal websites and just typed in the word gay and then just removed it, just deleted it. That's what it looks like.
Well, yes, but so I will tell you though, the court cases are making the Trump administration put the stuff back in some instances.
Mhm.
So I'll give you an example, and there's a terrible disclaimer, and I can maybe read it because I was looking for some of the health disparity data just to see the most recent information. If we remember in 2023, a lot of this playbook has already played out in Florida. So Governor DeSantis decided in that epic year of like our version of Project 2025 here in Florida to stop allowing Florida middle and high schools to report to the CDC's youth risk behavior survey. That's been collecting data since I think 91. He's like, no, Florida's not going to participate anymore. And so they were trying to delete all the health disparity information among LGBTQ youth. And the court was like, no, no, no. And there, other federal websites now also have the information, but they're putting very specific disclaimers on. So this one, there's a yellow band. So if you Google CDC and like health disparities among LGBTQ youth, you'll find this page. Bright yellow banner at the top. Per a court order, HHS is required to restore this website as of 11:59, February 14th, 2025. And he, quote, and trigger warning, pause here. This is not my language, but this administration's language, which to your point earlier, Laura, is really important. This is on a government website which is, it's meant to be the source of information that we should be able to trust. And this is how they're talking about it. Any information, quote, on this page, promoting gender ideology is extremely inaccurate and disconnected from the immutable biological reality that there are two sexes, male and female. The Trump administration rejects gender ideology and condemns the harm it causes to children by promoting their chemical and surgical mutilation and to women by depriving them of their dignity, safety, well-being, and opportunities. This page does not reflect biological reality, and therefore the administration and this department rejects it.
Oh,
So I don't think the court put any limitations on any kind of disclaimers they could put, but it's there top and center. And then you have years and years of data available to talk about. This is on a page to talk about LGBTQ students being bullied,
right.
LGBTQ students considering suicide. LGBTQ students feeling sad and hopeless, LGBTQ students being, um, you know, um, becoming addictive to various substances. Like there's a bunch of different reports that you can pull data from. Why this disclaimer at the top? I don't agree with the terms or the language or the framing, but it's such a juxtaposition of like just
Yeah.
it's not even like the same reality. I
Right.
I want kids to be happy and healthy, and I want them to live to adulthood.
Yeah.
So,
Mhm.
like, what about the dignity and safety and well-being of our children who are LGBTQ? Um, and so that chilling effect, I hope, I in a former life I ran an LGBTQ youth center. I continue to do work for youth or with families to support them. I hope people continue to seek out resources and help. I mean, like the we know the increase in calls to, the LGBTQ specific hotlines have been going up through this administration, and I know that will continue. Um, but I hadn't seen this, and I hadn't realized it had been restored, and I stopped and I didn't go check in a lot of other websites because I'm afraid of the same disclaimer language, and it's upsetting. I mean, I have a thick skin and I'm not completely numb to it, but I think I feel more the concern for the harm that that will cause. But I'm glad the court ordered the information back up because there are people all over gathering this information. They are worried that this will all be erased and will not be available to us. The
Right.
research will just be deleted.
Yeah. I
It's
mean, and
crazy.
that is seems to be what their goal is to be, is which is just full erasure, which is, I mean, it's nonsensical because I mean, trans people exist, have always existed, will always exist, and there's nothing wrong with that. Like,
No,
it's just a fact. Trans people exist.
that's right. We do. Well, and we're waiting on a big decision. We probably won't see the result until June or July for the Scrimeti case. So remember the
Hmm.
case the Supreme Court heard between the elections, but before Inauguration Day.
Yeah.
Um, and but that was very specific and narrow and just for gender affirming care for minors. It did not include surgical interventions. So it was just for um, the hormone replacement therapy or puberty
Or
blockers. So,
blockers. Hmm,
I want
okay.
to make a disclaimer really, really quick,
oh,
and
a
that is that
disclaimer.
the Stonewall Democrats will always support our transgender brothers and sisters. Always. We are
Absolutely.
not going to remove the T from the LGBTQ.
Yeah.
Trans people are they exist. They're our sisters and our brothers. They're our family, and we need to protect them. So I just wanted to make that disclaimer real quick.
You
Absolutely.
say disclaimers and then the legal guy, I'm like, uh-oh, what do we do?
No.
The disclaimer of support. Those are the best kind.
Yes.
No, I appreciate that. Well, we need that. I mean, there are, we saw a lot of healthcare providers leave the marketplace in 2023 when we saw our healthcare ban. And we've worked through, we had a Medicaid challenge and the state didn't follow the decision in that case. And we have healthcare providers who are scared about their licenses being at risk. And so, um, there are folks who are sticking around who are healthcare providers who specialize in healthcare for LGBTQ folks or for trans folks. But the HHS also this month launched a whistleblower portal. I don't know if you all have checked that out yet. But I won't quote the language there. It's more aggressive than what I just mentioned earlier, but they have opened up a portal for providers to basically report providers who are providing gender affirming care.
Oh my
Um,
gosh.
and it's the explanations, I as a young whippersnapper who was big into advocacy, I was actually really passionate, and I'm still passionate about Amnesty International and nonviolent protest. And um, I understood at a pretty young age about disparity. And so when I hear the Americans talk about and use framing language around international human rights abuses like, mutilation or
Yeah.
genital mutilation, which is not what's happening. It evokes so much emotion and a particular image in your head, which of course it's intended to do. And then there's no discourse. So like we're talking about a lot of things that, as you said earlier, Laura, both Democrats and Republicans and independents have supported, right? This is healthcare. I mean,
Mhm.
this is all we've got. YOLO. We got one life on this planet. We share this. I get it. We don't all get along, but we have to figure out how to share this world together. And we all want, the security and the peace to have our family, raise our family. We want to work, sometimes a little too hard.
Mhm.
Make whatever we can make to enjoy our life and hopefully be in a better position and maybe go on some vacations. And, we've got
Fingers
economic
crossed.
challenges. We hope, but like we're all struggling to do that, right? We're all
Yeah.
struggling to pay our bills and take care of our health, and we don't need any kind of added, layers of gatekeeping or basically closing the door, which is what a lot of these policies are doing. Like, no thanks, we don't want you. And I think where we started was maybe, everybody thought, oh, we're just talking about things for like little kids, minors, really young kids. And we've seen clearly the rhetoric and the policies shift and have everything to do with adulthood and try and
Mhm.
remove trans folks from all public life, no matter what it is.
I don't
Um,
know if people realize that when we say gender affirming care, it's
yeah,
not just trans people that or transgender surgeries or sex changes or anything like
right,
that.
right.
Gender affirming care is like the blue pill that men get. That's gender
Viagra
affirming
is
care.
100% gender affirming care. And this is,
So
Yeah,
what concerns me as a woman and in her, years is like because it's a slippery slope as you, mentioned alluded to, it's, we started with worrying about the kids and now it's
yep,
the attack on trans adults. I'm sorry, but like, is women's healthcare coming next? Like,
Well, it did
because
already.
Yeah,
perimenopause and menopause, that's gender affirming care too, like your hormone replacement therapies and whatnot. So it's like, where is it going to stop?
I think people should pay attention to the way it's messaged because a lot of the discussion that happens around the assumptions people make about gender affirming care, and I really appreciate you pointing that out, Christian. I mean, there is affirming care provided specifically because, an individual may be transitioning. There's broader health care that I need because I happen to be trans. And then there's just all the healthcare needs I might have. We see disparity in all the categories, right?
Hmm.
So um, I think when I worked on this a couple of decades ago, when we were first starting to talk about whether trans folks would be covered by insurance, people want to look at the numbers. It's a financial argument. Well, what's it going to cost? How many trans people are there really? And people are like, well, there aren't that many people. And they're like, oh, then it's going to cost a lot. But when they did the research, and municipalities were some of the first folks to start providing it, they're like, you know what? It doesn't actually cost us that much more. And then they were like, never mind, we can do that. And so not only do we have licensing that's sort of an issue, we also have insurance that's regulated by government, and that's another pathway that they can take away our ability to have equity and access. So a lot of trans folks are paying out of pocket, right? So we happen to have some providers that might have a sliding scale and be flexible. But if we are not having it paid through Medicaid, if we know that CMS, Medicare and Medicaid is trying to do rulemaking right now to say this is no longer an essential health benefit. This is not necessary medical care, is the argument they're making, which is what we were dealing with decades ago when we were first starting to fight the fight. We're having to refight it and, of course, relitigate it as well at every step of the process. And I mean, right, Laura, we're just getting older. Like we're gonna have problems.
Yeah.
Like, I mean, I played sports. My knee's gonna hurt. I hope I don't need a knee replacement. Let's see. I might have heart issues. Like, I mean, how's my cholesterol? Like, I want to trust that when I go to the doctor, I'm gonna receive, a holistic, approach, and I'm gonna be treated well. And if I have an emergency, that the same is true. And there are some healthcare providers here in the St. Pete area that do a great job, but there are others that don't. Or there are
Hmm.
others that are afraid to and maybe don't talk about it publicly because their funding is threatened by the federal administration or the state administration, or their providers' licenses are threatened.
Hmm.
Um, that's that fear, that retribution mentality. I And the problem is some states have chosen because for Medicaid, for example, and we've got a lot of trans folks that get their health care through Medicaid.
Yeah.
And it's a higher number than most folks, but I don't remember exactly what it is. But we have a lot of states that have written into their essential health benefits covering this for trans folks to have the federal government come down to a state-controlled program and say, no, 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 we're going to change this. That was a letter that went down to state Medicaid directors also this month that said, yeah, no,
Hmm.
you don't get to do this anymore. Now, some states are going to push back on that and we'll see where it ends up. But I don't want, I've known folks over the years that refuse to go to emergency rooms for fear of how they'd be treated.
Yeah.
I've lost friends to things that I know could have been fixed. Um, I, and I mean, men in general are not great at getting healthcare.
Nope.
Like super, super passive. And so, when I have lost a couple of trans guy friends that had, like a heart attack really young, like 30s or 40s, that just knew I'm not going to go to this hospital because they're going to treat me badly. I mean, and the stories are, I don't want them to come back, but I remember stories from friends like, oh, I went in for this infection and they wanted to give me a psych eval because I told them I was trans. That has nothing to do with this really funny looking rash I have. Can I, or my fever or, like I, I, I hope we don't go back that far, but that rhetoric,
Yeah.
that hate speech, when you start listening to it spiral and you see it printed on a government website,
Exactly.
validates it and it makes people believe it, even if they're like, I'm not really sure. they need to
And
go and get more information, and they're not providing it.
here's another thing that I'll point out is that Nazi Germany started with trans people first. Not Hitler came after the trans people first to try and get them out. So if you think that Trump is not going to come for you, you're wrong. He's destroying everything.
Yeah. I mean, and that's and I know it's like a tired trope and people are tired of us saying it, but the fascism is just like it's a word, it's a real word that has a real definition
Mm-hmm.
in real context. And it's scary to say it, but I definitely think that it's really terrifying that and this has just been a long time coming, that Congress has ceded their power to the executive branch over many years. And so unfortunately it was the America was a little bit ripe for the taking, and it got, we got a con man that took us. So,
Yeah, I mean, and the Constitution is more complex. This is why we hope the checks and balances that we have will do their job, right?
mhm.
And there are a lot of folks that sort of talk about us maybe being at a constitutional crisis. I think there are a lot of folks monitoring this and saying, okay, we're close. But the reason I have hope is, when folks like Chief Justice Roberts actually come out with their own statements and basically like snap their fingers or shake their fingers at the administration, like, no, no, no. There are decisions being made that are the right decisions for the right reasons. And I think what's tough is when you bring a case or a controversy to the Supreme Court, it's very fact specific to those plaintiffs. And so some of the executive order challenges that are happening are a little bit narrow because they're finding the plaintiffs for this one part and then we'll come after this one, later. And it takes time. And some of the decisions you're getting injunctions, they're like saying, okay, you don't get to enforce or put this policy in place until we work the cases. But other times they're saying, well, you can still do it until we get to the end result. And typically those decisions they are decided if we think we know where it's going to go. But we can't Monday morning quarterback that. We don't actually know.
Right.
We have to let it take. But I'm just grateful people are willing to step forward. I mean, discrimination period is underreported in the world.
Hmm.
Like, and that's another thing I worry about, that because people are feeling emboldened by this rhetoric. Um, I encourage, friends of mine who are attorneys to continue to do pro bono work, because is it housing discrimination, or was this just like a really bad like tenant who was a jerk and you need, somebody to help you with a landlord tenant issue? Um, what is it? Like we still have rights and we still have options. Like it's still illegal to discriminate against LGBTQ folks. None of that stuff is changing. So I'm worried about some of that, and I'm certainly worried about it in a healthcare setting because some of the state agencies are responsible for licensing folks. So we have to report discrimination to the state of Florida, but we also have a local human rights office here in Pinellas County because we have a very, expansive human rights ordinance. But even some of the state cases are still making good decisions. If people choose to fight and
Yeah.
if they choose to stay vigilant, if they know their rights.
Yeah.
Healthcare has always been a major issue here in Florida, especially since DeSantis has not done the Medicaid expansion
Yes,
that he was supposed to do many
that's right.
years ago. So yeah, healthcare is just so hard right now. As someone who is in and out of the hospital dealing with certain medical issues, it is tough.
Yeah,
So I can't imagine what my trans family members are feeling, you know.
it's a struggle, and I unfortunately it's a cycle, right? If we are having health issues and then we have stress and anxiety because we don't have access to the care we need, or if the appointment is now not weeks but months down the line, what I hope we do as a community is find other ways to take care of those symptoms, right? Like we have to remember to rest. We have to make,
Mhm.
time to talk to ourselves about what we're doing. Maybe find new methods like, meditation, or I have a friend was doing Qigong classes for the community and is going to maybe start them up again
Oh, cool.
soon. I'll tell you about that. But like I didn't know anything about, Qigong, and she recommended a book, and I felt, I was going just once a week and then trying to practice on my own, and I literally felt myself calming down in a different way than meditation, but even that's good. Or if you get off the news, get off your phone and get off social media. We have to take care of each other or find ways to provide spaces so that we can at least be strong enough to fight another day.
Yeah.
But that's even hard. Um, but we do. But you know, I I'm noticing some more like fun things like that popping up in community, and so I celebrate that. And it's almost June, so there's that.
It is. It's almost Pride Month. Yay. We're so
Yeah.
our favorite time of year. That and Halloween.
Exactly.
Yeah, 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 for sure. Yeah, no, I think there's a lot of things we can continue to do. And I just we find a pathway. If people are looking for, okay, this is great. Like we know where we were making progress. We know where we're going is probably not all good news. What are the impacts going to be? And we're kind of in a holding pattern a little bit, but that doesn't mean we're sitting on our hands.
No,
The
That
fight continues. We're going to continue to fight.
we are.
absolutely.
Absolutely. Well, as we start to wrap up this episode, it's been very informative and amazing. So thank you for coming. But we have our other segment to do, which is called shout out or shut down. So you can either shout out something that you love that's very good, positive, or you can shut down something that's bad, negative.
Yeah.
So
It's funny, I saw a headline out of your state, Laura, which was a shutdown. You probably saw this decision yesterday, but then I was like, no, in like trying to be excited because our our efforts and our planning for Pride Month are becoming, they're gearing up, as you know. And so I
Hmm.
think it'd be better to shout out something fun and positive. Speaking of doing things good in the community, I think, folks know I love, community-based events, and we just had our fifth anniversary for the Tampa Bay Trans Film Festival, which we host here in St. Pete. So I want to give a shout out instead to our two trans-centered events happening at St. Pete Pride this June. And they're up on the St. Pete Pride website, and there's lots of other events happening, but we have a Trans Pride March that'll be leading the parade, and you can get to that if you go on the Saturday link for the festival and the parade. You can sign up for that. And then Transtastic. I think those are both really great events that are happening, and they happen 2 weeks apart. So they've changed the date and the location. So Transtastic will be happening at the James Museum on June 18th. And then the following Saturday on June 28th, the Trans Pride March is there. And I'm really excited. We try and do something new and different as we continue to evolve. There's a community host committee grounding this and centering this of, by, and for the local trans community. But people have flown in from all over the country to go to some of these events over the years because it's so special. But this year for the St. Pete Pride for the trans events, we're doing a T-shirt design contest. So yep, today was the deadline. So all the submissions are in, and we're going to vote on those soon. So when you go to Pride this year, there will be a local artist featured on that particular Trans Pride March shirt. And
That's
so that's our
awesome.
new, yeah, it's super cool. So um, I don't know what it'll be. I haven't seen them yet, but I'm really excited about that little piece. But feel free to go to St. Pete Pride's website and come and join us, come support. And if you can't make it, maybe think about making a donation so that somebody
Yeah.
in the community can be gifted. We're going to do some scholarships for folks who can't join, so you can always just donate.
Awesome.
Yeah.
All right, Christian, would you like to go with what do you have, a
What
shout out or a shutdown this
are you
week?
doing with your microphone there?
I was putting it on mute because my dog was barking. But um I really you're right. I want to make it positive this week because there's so
Okay.
much negative going on.
Okay, then you go last because I gotta shut down.
Oh,
Okay,
So
go
we'll
ahead.
sandwich it. We'll put
Go
we'll
ahead.
put we'll put
okay.
my shutdown in the middle. I am going to shut down the entire situation with Jeff Knight and Janice Live. I am for people who aren't aware, Jeff Knight allegedly I think we still have to say caused a boating accident where someone died and many more injured. And the facts of, he left the boat that was driven by someone was left the scene of the accident and was driven 4 miles away. No 911 was called, not, it, and this person owns Janice Live, The Landing, Detroit Liquors, and Pelican Pub. And Janice Live released yesterday a really, really, really crappy statement that was basically like, don't judge anything. We don't know anything. And then today followed it up with, oh, by the way, he's stepping aside from activities at Janus, which I mean, he's still making the money out of it. So, personally, I won't be supporting them until there's divestiture or at least some accountability to Jeff Knight. The fact that he is walking around and that didn't get handcuffed, didn't get arrested, didn't not like that he's just scot-free is astounding. Because I'm pretty sure we all know that if the man who died, Jose, had been the boat driver, this would be a completely different outcome. So that's my shutdown.
Absolutely. Well,
Really
like I said, I got a
great.
positive one, so I'm going to shout out some people. And really, it's a group of people because I'm going to shout out my brothers and sisters in the trans community because it's so frustrating for me to see the T being taken out of LGBTQ. And there one of our other sister caucuses was told by their donors that they would not be donating money to the caucus unless they took out the T from their name. And I hate that. It's disgusting. I want to shout out all of my trans brothers and sisters because you are worthy. You are important. We need you. And I hope that even those not trans step up more. We need to protect our brothers and sisters, our family. We need to protect our community.
Absolutely. You are right.
I think that's a big part of the rhetoric too, is to divide us, and we can't
Mhm.
let them do that.
Yeah,
They're coming for us all, and we know that famous poem. And at the end,
absolutely.
we all should be there standing arm in arm,
Mhm.
Exactly.
fighting to save this democracy.
Absolutely.
Precisely.
Well, thank you so much, Nathan. Before we jump off, is there anything else you wanted to say to our listeners?
No, I mean, thanks for tuning in and thanks for having me. You guys are doing great work. I really appreciate it. I love the name. Like, this for St. Pete's sake, like we got to talk about all the topics that are relevant. And this is a really beautiful, diverse community. And so thank you for, doing this and providing the ability to connect with folks. I'm honored. It's great.
Absolutely. Well, thank you again for coming. It's really amazing to this whole conversation has been incredible. So thank you for coming.
Thank you.
All right. So please remember to like and follow us we are on Facebook, Instagram, TikTok, and YouTube, and that you can find us at for Saint.Pete's sake. That's at for Saint.Pete's sake. Don't forget to subscribe to our podcast wherever you listen and tune back in with us next week where we'll have more stories about the hard work that the people are doing to make the community better. Until next time, for St. Pete's sake, keep pushing for change.